Liberia was in the process of trying to rebuild a health system that had totally collapsed during the periods of conflict. And when Ebola hit, we just did not know what to do about it because the systems we had, already inadequate, became places that people were afraid to go to because people were dying. Nurses, doctors, health practitioners were all dying because of the Ebola. And so the whole health system came close to collapse. Most of our investors left the country. Even Liberians left the country with their children for their safety. It taught us that, in a way, we have to, first of all, depend upon ourselves and be the first ones. We finally defeated the disease because of the involvement of our communities, taking responsibilities, doing the contact tracing, being the ones that first were the first responders. But it proved that using the communities as first responders in terms of providing information on those who are sick, and then quickly having health systems communicate with each other, pass information, has proved to be very effective. Most of our hospitals and our healthcare systems now have a special facility for triage so that anyone coming in, they first have to go through that system, they first have to go through an examination to make sure that there are no signs of infectious disease before they will be admitted to the hospital itself. And that has proven to be very useful for us. We didn't have that before Ebola. And that, through the triage system that I talk about, through the vaccines, through specialized training, we're putting that in place. Liberia has, in a way, regained to a large extent the trust of its people. However, that trust will only last if we can do more to rebuild the healthcare system, and we have a long way to go. We don't have enough doctors, we don't have enough nurses, we don't have enough health facilities, particularly in rural areas. But today we feel confident that with the program we have in place, to be able to build that resilience, that we can now manage the situation and we continue progressively to get to the place where our systems will be able to handle any infectious disease with which we are faced. A sick nation cannot be a working nation.